What a geriatric assessment does is basically allows for identification of patients who might be at higher risk for severe chemotherapy toxicity. So what geriatric assessment is composed of is basically a survey that basically looks at a patient's functional status, their comorbidities, cognitive function, psychological state, social support system around them, and even their social activity, nutrition status, all these kinds of things that are incredibly important. And in general, a standard history and physical that an oncology team does will cover some of the components of this, but some of the more subtle nuances that are very important. For example, a person who has problems taking their own medications, that might not come out in a regular history and physical. Some of these things have some stigma around them, and they may not actually pop up at times. And so this is essentially a communication tool in some ways that allows for patients to have more voice and opens doors in terms of talking about certain issues. What we found in terms of feasibility is that both electronic platforms were feasible. It took about 15 minutes on paper, which is our baseline, and then in terms of the support screen, it only took 16 minutes on average, and in terms of the REDCap survey, it took 21 minutes. In terms of preference, patients did prefer the computer electronic version, the majority of patients. The questions themselves were not upsetting to them. They thought it was the right length, et cetera, et cetera. So there was some, the patients did like the survey. In terms of reliability, test, retest, paper versus electronic, there was excellent correlation between those different platforms. In terms of validity, in terms of looking at the different domains of the geriatric assessment, there was a weaker correlation, and that's understandable because each domain of the geriatric assessment looks at different things, and understandably, there's not going to be concordance always. So in summary, the electronic geriatric assessment is feasible and also reliable. And this is a very important tool that, in terms of one of the themes that has come up in this year's ASCO meeting has been integration of information into the electronic medical record in order to learn from every patient's experience. And one of those key things is to make sure that we have a better understanding of what a patient is going through or what characteristics they have in order to make sure that we are collecting that information to learn from that.